crack open the seal. It's another show. What? 20-some seconds, it looks like. Over. I'm still not looking in the right place. Hey, everybody. How you doing? It's time now for Stages of Life Radio. And I'm Melissa Fox, and I'm hosting the show along with Dr. David Klein. Right now, we're just on the internet, but very shortly, in like 10 seconds, we're going live. So hold still. Here we go. See if it all works out like golden.
It's time for Stages of Life Radio with Dr. David Klein. Have a medical question? Call 407-422-1212. That's 407-422-1212 or text 23680.
Welcome, guys. I am Melissa Fox, hosting the next couple of hours. This first hour, though, Stages of Life Radio with Dr. David Klein. How are you today?
Well, I'm feeling absolutely marvelously.
Marvelous. Okay. And that is because it's Sunday? It's because it's radio day?
Yeah.
No particular reason?
Well, it's because every day is a good day when you have the right attitude.
What? That is true.
Mm-hmm. No, it makes a huge difference. You know, when you wake up feeling sorry for yourself, sorry for the things going on in your life, you're doomed to have a really lousy day. Mm-hmm. On the other hand, I don't care how bad a deck you're dealing with or what kind of hand you've been given. If you go into it with the right kind of attitude, you're going to come out with a much better day. And I've learned this, from patients that have things far worse than any hand I've ever been dealt. And they come into the office and they're just pleasant as can be, pleased that they're breathing. And you kind of learn from that. And then you have people that have everything, especially relative to the rest of the world, okay? Everything, and yet they're unhappy. So if there's one thing that I've learned, it's to make myself happy, because nobody else can do that for you. Nobody can make you happy.
That is very true.
So,
words to live by there, Gandhi.
Yeah, so you start the day off with an affirmation. Now, this isn't the kind of goofy woo-woo, gee, I'm going to burn, incense and beat on drums. No. You just wake up, and you go ahead and you count your blessings in a manner of speaking. You get up and you start thinking, it's going to be a good day today. What am I going to accomplish? Who might I meet today? What might I do? I have another opportunity to either do something good in the world, or just enjoy my life, whatever it happens to be. You have that available to you. So there's no excuse, other than chemical depression, which is a treatable medical illness, to not have that attitude. So you can be your own worst enemy, and you can be your own best friend. I encourage you to not be your own worst enemy. So what we're going to talk about up front today, what we're going to be focusing on, at least for the first part of the show, is subclinical thyroid disease. Okay, what is this all about? And why do I care? And why should you care? And the answer is very, very simple. Thyroid disease gets misdiagnosed probably 2/3 of the time. And the reason is very simple. Because people, doctors, nurses, nurse practitioners, the whole lot of them, rely on objective findings, usually of a laboratory nature, in order to come up with diagnoses. And this is a very lazy way to be an artist. There's an art to science, okay, art to medicine. There's a science to medicine as well. But when you're relying on numbers alone, you're going to fail. So I was reading yesterday, I bought a book on Sir William Osler's quotes. Now, Osler was a late 19th century, early 20th century physician, English guy. Okay, and he spent a good bit of time in the United States, and there are doctors at that time and ever since that worship this guy as being just a sage. Okay, Yoda with an MD after his name. And some of the most interesting things in his quotations have to do with the fact that most diseases don't present in similar ways. And what I've always found, at least in my practice and in my limited 42-year experience, is that the textbook presentation of anything is the most rare of all presentations. And I learned that actually in my first year of medical school. We were walking around, the hospital, trying to look and feel like doctors. We didn't know diddly, okay? But we had these neat little short white coats, which identified you as a first-year medical student, right? Second-year medical students, they had the short white coats with white pants. When you hit third year, man, you got a long white coat. You were cool. Okay, you knew who the big kids were just by what type of coat and trousers they were wearing. And so I remember watching, along the hospital, and you'd see just groups of white coats running in one direction or running in another direction, very reminiscent of seabirds, right? Okay, they just look like a bunch of seagulls down the halls. And it's like, okay, what's going on? Something dramatic must have happened. And what it was, okay, somebody was feeding the birds. There was a textbook presentation of something, and nobody wanted to miss it. So they'd go running in one direction. Hey, guess what? There's this down the hall there. And they'd go running this way and that. And then it occurred to me, okay, that you have a ward. Each one of these wards had 36 to 40 people on it. They had 3 wards attached to one nursing station, 120 patients. Yet at any one particular time, there was nobody that had a classic presentation of anything. And it was then that I realized that much of what we're being taught was really pretty nonsensical, which is, well, in order for you to make the diagnosis of X, Y, and Z, you have to have all of the above. And the answer is nobody ever really taught us that. But when you read the textbooks, well, these are the list of the 15 symptoms of this disease or that. And this is why Dr. Google and WebMD and whatnot are such pathetic excuses for people think they're doing research. Because each of the symptoms that you see for a particular problem, or let's just say laboratory findings or physical diagnostic findings, may not occur at all, which is why it is so difficult to figure out what's wrong with you. Okay? Because there's an art to what it's all about. So with diagnosis of thyroid disease, the doctors are running around looking typically at TSH and T4. These are 2 parameters. They're important. Okay, it's really, really important to know what the pituitary thinks is going on with regards to your metabolism. But you know something? There are a lot of ways that TSH gets screwed up or gets blunted, and you miss the diagnosis of hypothyroidism. In fact, the numbers are legion. That's a lot of you if you're from out west here. Okay, so there are lots and lots of reasons for this to happen. What about T4, which is a pro-hormone? T4 is actually an inhibitory thyroid hormone. So do you really necessarily care what the T4 level is? And the answer is yes. It tells you whether or not you're producing it, but it doesn't tell you whether you're hypothyroid or not. To the effect that if somebody came in thyroid storm, that means you have way too much thyroid going on. What do you do to treat them? You give them propranolol, it's a beta blocker, Inderal, okay, same thing. Digitalis to protect the heart, and then you give them Synthroid because it actually inhibits T3, which is the active hormone. I learned that lesson. I guess I was the first or second year after I went into practice. I ran into a patient with thyroid storm. I'd read about it, didn't know what to do. The general surgeon came in and goes, oh, yeah, thyroid storm. Haven't seen that since I was in Africa. And he rattled off what to do about it.
Wow.
It was very cool because the internal medicine docs didn't have a clue. This was before we had the internet. Now anybody can check it out and say, oh, well, now we can really screw this up well. So how does this happen? So when your thyroid is not working, or it's not working well enough, okay, it can happen from producing thyroid inadequate. It can happen as a result of destruction of thyroid hormone that's there. It can happen from counterfeit thyroid hormone called reverse T3, and it can happen from exogenous consumption of medications and or dietary supplements, substances, that inhibit thyroid function. So you have primary hypothyroidism, secondary, tertiary, and functional hypothyroidism. And only one of these things really relies on TSH for diagnosis. And even at that, you can have something called euthyroid sick, which means that you have a sufficient amount of TSH, or the right amount, and yet simply be hypothyroid. The most important physical finding, the most important laboratory test, the most important anything that you're going to do with the diagnosis of thyroid disease is take somebody's temperature. Temperature is really the driver. That's what's going to tell you whether or not you're hypothyroid or not. Nobody is hypothyroid with a normal temperature. It doesn't work that way. So what do? In medicine, when was the last time you went to the doctor's office where they took your temperature? Think about that one. They may get your blood pressure and pulse. They often get your weight. They never get your height. And they only rarely take a temperature. And that's, here's the way this goes. They look at you and tell you they're febrile or afebrile. It means either you have a fever or you don't. dumb. Makes no sense.
No, that doesn't make any sense. What does make sense is to take some phone calls. So in the next segment, let's get someone on board, shall we? 407-422-1212. Or you can text your question as well. 23680. Just mash that into your phone and then text us your question. Also, we're on the internet right now on the social media. Facebook at Stages of Life Medical Institute and also on the WFLA Orlando page. We'll be right back. More information, stagesoflifemedicalinstitute.com.
You need to go over common symptoms.
Fair enough. That'll be the next
Like what does thyroid feel like?
Okay.
Okay, we can do that. Well, we're still on, of course. Hi, everybody watching us on the internet, on Facebook. We appreciate you very much.
Periscope.
Periscope, that's right, we're on Periscope.
And TikTok, I guess, if they're still downloading that thing.
No, we're not using TikTok. I
Good.
refuse. No, I do. I refuse to use TikTok, Doc. I
I don't even know what these things are.
TikTok. So I didn't get a text from my boss, so I guess everything was cool there. No, hey, why is there nothing on? Why are we listening to Dave Ramsey? That's my favorite one. I don't know if you're.
Why are we listening to Dave? That's a question I've often asked myself: is why are we listening to Dave? Actually, I like the guy.
He actually is a really
Dave
thrifty
Ramsey is a
dude.
good dude.
Yeah.
You know, he's got an interesting twist on life, which is don't get into debt. No kidding.
Wow.
You know,
Pay
you
it
wa-
off as quick as you can.
Yeah, here's the deal. Okay, the guy's made a fortune, which you can summarize into one sentence: don't get into debt.
I like
God bless him. He's exactly correct. You know, now that you've heard that, you don't need to listen to a show.
Yeah, well, there you go. Now it's covered.
Actually, I like his show, but that's
All right,
okay.
Let's see what we got going on here on the. Oh, hey, Debbie. Debbie says, hello, everyone. Glad I got to listen today. Melissa and Patriots just won. I saw that. Can the doctor tell me if you are allergic to seafood? Now, this is
Can you be allergic to seafood?
I was going to say, first of all, this was something that happened many, many, many moons ago when she was a child. She had an allergic reaction and has not eaten seafood since. Can you take fish oil and if you're allergic to seafood? And second, what is an alternative medication to Prevestatin? I've been taking it for 8 years, and I don't like all the things I hear about it.
Yeah, you want to talk about something that's a problem. Seafood's not, generally is not one of them. Fish oil, if it's properly distilled, is unlikely to cause you any seafood issues, seafood allergy issues. So you're looking for a fish oil that's been distilled at least 5, if not 6 times. 7 times is better, but 5 or 6. And the way you can determine that is by looking at the EPA and DHA content relative to the size of the capsule. And if that makes sense to you, God bless you. Okay, but if you go on stagesoflifevitamins.com and just look up heart, H-E-A-R-T, and sole, S-O-L-E, the fish oil will pop up. Look at the ingredients within it. Those things are 1 gram capsules. And if you can sort through the amount of EPA and DHA combined relative to the 2 grams for 2 capsules, you'll understand what 6 distillations looks like. And if it's less than that, it's going to be 5 distillations or less. And that pulls the fish protein out of it. With regards to may you still be fish, let's say allergic? The answer is probably not. The longer you stay away from these proteins, the more the body tends to readapt. So what I would do would be to test it with just a little bit of, let's say, tuna or something along those lines.
All right.
But make sure somebody's around that knows what to do. All right. Generally speaking, it's shellfish that causes the problem, and it's a very, very different issue, very different protein altogether.
Jen is watching. Are you over in Massachusetts, though, hometown? She says she's loving the topic about the hypothyroid, has that, and she has Hashimoto's as well.
Well, no, she has Hashimoto's principally and hypothyroidism results. It's the same disease, actually.
Right. We can talk about that in a little bit. We got about 45 seconds before we go back onto the radio part. Which is good.
What I will tell her, okay, what I will tell you is this, is that I too have Hashimoto's.
Hi.
Okay, so hypothyroidism can come from production, destruction, autoimmune disorder, which is the destruction portion, counterfeit, which is reverse T3, and then functional, which is soy consumption, daidzein, genistein, that's lecithin consumption. So when you have autoimmune thyroid disease, your body generates antibodies to either the transport protein or to the converting enzyme. That's T4 to T3, the converting, which is 3,3,5' deiodinase, and then you become functionally hypothyroid from the autoimmune thyroidism.
Here we go. And we're back again. I just wanted to let you know that, okay? Hi, everybody. Welcome to Stages of Life Radio. And that's the cool thing about live radio is you can tell when it's live.
Yeah, we make
It's like,
mistakes.
what? The radio's on? Oh, we're back. Oh, there's dogs barking in the back. Not all my dogs are barking, though. Hey, it's Melissa Fox. How are you? We're answering all kinds of questions today, but the doc, Dr. David Klein, from Stages of Life Medical Institute, loves a challenge. So if you've got one, 407-422-1212. Again, 407-422-1212. Today we are talking about subclinical hypothyroidism and also weight loss.
Yes. Well, weight gain is what really happens from hypothyroidism.
Who you
So
telling?
you start to pork out a little bit, even though, well, I'm not eating that much. Well, I tell you what, I've done this a long time, and I've heard a lot of people come and telling me how little they eat. And so Dr. Phil, as I understand it, was invited over Oprah's house for a weekend to watch Oprah and her friends to
Eat
figure
pasta
out,
and
yeah,
bread.
to figure out why they all gained weight. And he came up with this particular observation, which was you eat too darn much.
Eat too much.
Okay, so if there were an easy fix to weight gain, Oprah would be skinny. Fact. Now let's look at thyroid disease. So when you start getting older, you have the opportunity to let's just say accumulate more disease states, more micronutrient deficiencies, depending upon where you live, what your ethnic background is, what you prefer to eat and what you prefer to avoid is going to determine whether or not you start to develop these things. So the symptoms of hypothyroidism, the ones that we're going to talk about here, weight gain, not the first one, okay, depression, may be the first symptom of hypothyroidism. Heavy irregular menstruation, if you're a girl. Okay, if you're not a girl, you don't typically see that, although men do suffer from menstrual issues. Ask anybody that's ever had a wife that did.
Another
so
day.
you do suffer from them, believe me, one way or the other. What else? Okay, you'll see bitemporal headaches.
So
Why?
easy
Because it
to-
pinches the nerves that go up the side of the head. Carpal tunnel syndrome, tarsal tunnel syndrome, then it just keeps going and going and going. But what do you see typically? You typically see a lowish temperature. And so you'll have people listening in right now that are going, well, I have a low normal temperature. And I'll go, well, there's nothing normal about you. Okay? You're supposed to have a temperature of 97.6 at 0400. That's 4 a.m. for you non-military sorts. And it should get up to 99.6 by 2200 hours, which is 10 p.m. for you non-military sorts. And so why? 97.6 to 99.6. And it's not supposed to vary from that because we are all generally human beings. All right? Some are questionable.
It is.
Okay?
It is a
You know what I
question.
mean? You just wonder about some of them. They are among us. But 97.6 to 99.6. So if at 3 o'clock in the afternoon you come into my office and your temperature's 98, you are cold. Okay? If you come in the morning, it's let's say 9 o'clock, and it's 97.6, you might be okay and you might not be okay. But if you ever hit 96s during the day at home, you are ill. Now, what does this mean? It means your cholesterol is going to go up. Okay, that's wickedly important to those of you that have thyroid disease and wonder why you're taking things like rosuvastatin, atorvastatin, lovastatin, and whatnot. The reason is simple. Hypothyroidism, that's low thyroid function, results in elevated cholesterol. And in fact, that used to be the number one blood chemistry test to confirm the suspicion of hypothyroidism. That's just the way these things went. So that answers one of our internet questions. Okay, well, gee, I have Hashimoto's and I take cholesterol meds. What do you think? And the answer is I understand why. It's because you're being undertreated. When you treat thyroid disease adequately, cholesterol returns to normal. And what's normal? 175 to 190. That's really where it should rest. But you can do this by using blood work combined with simple questions. How do you feel? How are you resting? How's the depression doing? How are your menstruations doing? Are they still heavy? How many days are there? Are they 3 days, 5 days, 7 days? Or are they all month? And so these are the sorts of things that make a difference. If you get sick and you know you're sick, you've got the flu, but you don't throw a temperature, because after all, I never have a temperature, you may have hypothyroidism.
Could be.
Now, why do you think your body wants to throw a fever? It's not to bake off the virus or bake off the bacterium. You got to get to 140 to 160 degrees. Anybody who cooks knows this to be a fact. If that meat doesn't hit 160 degrees, that poultry could kill you.
That
You know,
pork will give you nightmares.
You with me?
Too.
Oh, it'll make you ache all over, and trichinella is one of those sorts of things that nobody ever forgets and can't get rid of. So what is it? 101 degrees doesn't kill anything. but that happens to be the temperature with which your immune system works best. So when you have your kids and they have a fever, if it goes up to 102 or 103, sure enough, give them a Tylenol. But if they go to 100, 101, you leave it alone, because that is where they're most likely going to fight the infection. Yes, you feel a bit achy. That's not a problem. Nobody's going to die from feeling achy. But you certainly can if you let the infection get out of control. So temperature regulation is what thyroid does. And when it doesn't do a good job, wouldn't you know it? You are at increased risk for infection. And more interestingly, you are at increased risk for cancer.
Oh.
Yeah, so if you don't believe it, go to the National Library of Medicine, PubMed, that's pubmed.gov. It is a free service of your National Library of Medicine to anybody who's listening right now, and those that refuse to listen, as it turns out. And you put in Hashimoto's, a space, a plus, and then put in cancer rate or cancer risk. And you're going to start seeing all kinds of articles looking at the association of Hashimoto's with increased breast cancer risk. So that is just the way these things work. So how do you make the diagnosis of hypothyroidism, you might ask? So you go in and you get blood work done. There's no salivary studies that will make any sense of this or anything else except for salivary amylase. If you're paying for salivary and hormone testing, you are wasting your money. So what do? Blood work. And so the way I test for it, which is the way I recommend it, is T3, T4. Okay, that's the active hormone and the pro-hormone. Free T3 and free T4. Why? Because it's really helpful to know what's being delivered to the cell membrane. Something called T-up, that's T-uptake, to find out what the proteins, the binding proteins look like. And then most importantly, TSH combined with TPA and ATG. What does this mean? It tells you what the pituitary gland is doing and what you're doing as an individual to rip up this particular hormone. So thyroid peroxidase antibody, or TPA, is the most common of the antibodies against thyroid. And what's the normal amount to have around? This is where it also gets interesting for the null savant. Okay, well, look at the reference range. The answer is negatory, Batman, because if a third of the population has this problem, only the really bad ones are the ones that are going to get parsed out by this. But your body should not see any TPA or ATG. Background noise notwithstanding. So if you see levels of 3 to 5 IU, that may be okay. But with some of the big labs, they'll say, well, it's normal up to 33. Frankly, when if it's over 3, it's a problem. So you will miss what's going on. So the blood work is wickedly important. And then how do you deal with it? What do you do? Okay, how do you fix this? Well, if you think you're going to fix it by taking Synthroid, you're probably wrong. Gets back to what I talked about just a short while ago with the hyperthyroidism. One way to protect the patient from death is to give them Synthroid. So let's think that one through. Why is that? So if somebody's in thyroid storm, which I've only seen 2 in my life and I hope never to see a third one, you give them something that is inhibitory of the main hormone. That's T3. So I treat hypothyroidism using a combination of T4 and T3, T3 being the active hormone. If you use the T3 by itself, it can be very dangerous, if not tricky. So I use a combination. I can do it by using Synthroid, Levoxyl, Tyrosint, combined with Cytomel if you don't mind spending a lot of money. The way I prefer to do it is to use a natural product like Armour Thyroid, Nature Thyroid, West Thyroid, NP Thyroid. And that gets you both the T4 as well as the T3, and then a couple other ingredients that we really don't understand so much about called T2 and T1. T2 actually may be the hormone responsible for weight loss. So you're never going to see that by taking T4. It's not going to happen. So a lot of folks with hypothyroidism that are taking Levoxyl, levothyroxine, gain weight. Mm-hmm. Yeah, and you're out there. You know it.
Hello, hands in the air.
Yeah,
Brock.
Gotcha. Okay. Yeah, well, you know that. So my dog, my golden retriever, had hypothyroidism. Okay, I would not treat that dog.
Did you just compare me to a dog?
No, but you have many. So, but
Yes,
I used Armour Thyroid for my dogs. Then I switched her to.
We got George on the line. We're gonna take his call coming up next. Got a little knee issue.
Cool.
We've got a bunch of texts, and it looks like the social media on Facebook, at least, we've got a bunch of questions to answer.
All right.
During the commercial break. So if you get a chance, you might want to check us out, Stages of Life Medical Institute on Facebook, or just stagesoflifemedicalinstitute.com. Text us now at 23680. You're listening to Stages of Life Medical Institute Radio on News Radio WFLA Orlando. Almost messed that up.
That was pretty good.
Sort of messed that up.
No, you didn't mess it up.
Nah,
It was melodic. It was
yeah,
poetic.
well, it's sing-songy. That's what I do. Okay, so Jen's got a question for you, and so does Pam. Jen is the one who said she had Hashimoto's and hypothyroidism. She said she doesn't want to take Prevestatin when her cholesterol was high. Use lemongrass oil topically. I do take the levothyroxine.
That's why you got problems. You're taking Voxel.
And that's what I had to take, too. That's a problem.
Yeah.
I'm adoring this information. Thank you. No doctor will test my reverse T3, although I've asked many.
Why not? It's a simple lab test. It costs about $20. So it's really not that big a deal. Our T3 is kind of interesting, but what you really need to have tested is TPA and ATG. Okay, antithyroglobulin and thyroid peroxidase antibody. If either of those two are positive, then you've nailed the diagnosis.
Nice.
Short of that, you really haven't.
Okay, Paula says she has stage 3 CKD. How do I treat that?
Yeah, it's chronic kidney disease. Okay, stage 3 means that your EGFR, okay, your estimated glomerular filtration rate is below 60 milliliters per minute. Okay, so what does that mean? It means that you're heading down the tubes. So generally speaking, what I would do first before I did anything else is I'd get a uric acid level. It's spelled URIC, uric acid level. Because frequently in the practice that I have right now, when people come in with a chronic kidney disease, they have elevated uric acid levels. Now, when you have uric acid in higher levels, it will not only cause the kidneys to crystallize, but it also causes gout. So subclinical gout can lead to chronic kidney disease. So 100 milligrams to allopurinol 2 or 3 times a day lowers the uric acid level, and you can watch that the EGFR go up. The second thing I do, which is actually second and third, is I use high-dose folic acid and something called L-taurine, which is an amino acid. So the L-taurine is 500 milligrams 4 times a day. The folic acid is 5,000 micrograms a day. The cheapest way to do that is to go on stageslifevitamins.com, look up Hyper, Hyper, folate, and it's like $4 a month. Very, very cheap stuff. And that also will help reverse the cholesterol levels, lowers cholesterol, reverses plaquing, and improves EGFR. It's one of the coolest things that I do. It's also one of the least expensive.
Really?
Yeah.
Oh, how about that?
What else we got?
Let's see. Oh, yeah, a lot of people, and we might save this one for on the air, because there's a friend of mine who just got off Metformin. She's been a hypothyroid mess for years.
Yeah.
She's very, very overweight, and then all of a sudden, boom, backwards, and now she's gotten off the Metformin. She's supposedly feeling better, but still has horrible days.
Yeah.
So, people are asking if it's safe.
Metformin's marvelous. I take 1,000 milligrams twice a day. That's what I take. Why?
Why?
We will talk about it when we get
got a
back
whole
because it's
minute.
Oh, I do.
Talk about it on the air.
Fair enough. Oh, we can talk about it in the air. But in any event, metformin reduces your risk of cancer, all cancers, by about 50%.
Okay, I do want to take
Sounds like a
George's
good
call.
idea.
When we get back, I want to take George's call.
George?
George is an old man
I
with
know.
knee issues from Orlando. And then we can get back in here. We got treatment for cholesterol. These are all radio questions.
Okay, cool.
45 seconds, guys. Awesome. Share this if you love it. Susan says she's so glad the doctor's now on News Radio WFLA. I don't even pay these people. They just, show up. That's pretty crazy.
Hey, you just gave Melissa here some job security. It's all good.
Little cred. Thank you. Thank you very much. Welcome to Stages of Life Radio every Sunday, 4 o'clock, with Dr. David Klein from Stages of Life Medical Institute, right here in Longwood, Florida, just off of I-4 and State Road 434. I'm Melissa Fox. You know me from Good Morning Orlando and some other stuff, I'm sure, like Connections, which is also sponsored by Stages of Life. Today, the doctor has been talking about hypothyroidism, subclinical hypothyroidism, as well as weight loss, weight gain, statins, so much to talk about. But we have George on the line, and George has got... Hey, George, how you doing today? George.
Hey.
Hey, George, how you doing?
Hey, Doc, how's those two vintage Cadillacs doing?
You know, I'm very pleased with those things. You know, they make me happy. You know, so the 36 is kind of sitting there just waiting for me to crank her up today. Yeah,
All right.
Yeah. In fact, I'll probably be doing that when I get home this evening.
Looks like George has followed you over to your new home over here on News
He found
Radio,
us.
WFLA Orlando. So, George, what's wrong with your knee as a 74-year-old young man?
A young man, yeah. Well, I had torn meniscus on both knees,
All right.
and I had them both operated a few years ago. I'm having a little bit of trouble with the left knee, and it kind of hurts, you know, especially in the morning when I get up.
All right. Does it bother you when you walk or cross your legs,
Yeah.
anything like that? What about
When I walk?
Yeah. What if you're standing still? Okay, you're standing erect, upright. Okay, and you twist from your left to your right. Does that tear into it?
A little bit.
All right. So, but if you cross your left leg over your right, okay, that would cause your knee to hurt.
I don't know. I've never tried that before.
I want you to try it there, George.
Let me try it real quick.
There we go. I had a show up in Virginia, okay, and I used to examine people on the air a lot until I
No, it
realized.
doesn't hurt, Doc.
Okay,
Hey, look at that.
All right, what I was looking for was the Sartorius muscle, because the Sartorius muscle will cross the knee, and that, in fact, is sometimes a cause of persistent postoperative knee pain. But there's a nerve called the saphenous nerve that will often cause postoperative pain. So you go back to the orthopedic surgeon, they tell you, well, we did the best we could. Your knee is stable, and yet it still hurts. When they did your knee surgery, you were either knocked senseless or you were completely knocked out. But they put on your thigh something called a double tourniquet. Now, this double tourniquet is cranked up to 450 torr. Now, if you've ever put on a blood pressure cuff on your arm, it starts to get uncomfortable at about 180. Yeah, it's too tight. People start to whine. You know, even if their blood pressure's high, you got to get it over the level of their blood pressure to measure it. But in your thigh, it gets to be 400 to 450. But the edge of that cuff sits right over what's called Hunter's Canal, and the saphenous nerve emerges at that spot, and the edge of that cuff can damage the nerve, and it will cause pain in the inferior portion just below your kneecap, and it will look every bit, for intents and purposes here, that it's persistent ligament damage. But it's the saphenous nerve, and it's really kind of an interesting problem to get. It's treatable, George. It's not that big a deal to do it. It doesn't require any needles, doesn't require any surgery. Medications by mouth maybe, but I usually use a transdermal called ketoprofen gabapentin. The key concept here, though, is it's in a base called wrench anhydrous base. And it goes through, if applied in the right spot, it goes through the skin in about 60 seconds, hits the lipid tissue, the fat around that nerve, and settles it down quickly. I mean, 60 seconds, the pain goes away. So that's the most likely possibility here. So when you're lying down in bed, the legs are straight out. Okay, those muscles, the abductors and the adductors, they're sitting in the inner portion of the thigh. They will pinch that nerve in Hunter's Canal. When you start to bend your knee, it tends to give it a little bit more freedom. And when you're standing up erect, the muscles tighten up. So the abductors tighten and then pinch that nerve. And when you move in certain ways, the abductors will move they move asymmetrically anyway. But what'll happen is they'll pinch, almost like a scissoring of that nerve, and will cause it causes agony. It's not a lot of fun. So that can be fixed for about $30-$40 worth of keto Gaba in wrench hydrous.
That's not bad.
So George, give me a holler, okay, if you want to come on up our way. Now you live in Kissimmee, don't you?
He's actually wandered off into
I
Radio Land.
I believe George is from Kissimmee.
Yeah, I think he said Orlando.
Yeah, he calls about every 6 months.
Yeah,
he's got some problem.
Checks on
you know?
that, right?
Yeah, he just wants to hear.
Let's check this text
Caddy's
line
doing.
for a minute here. We've got, well, first of all, what's the treatment for cholesterol? 272, the LDL is 173.
272. The first thing I would do would be to bring it down using something called bergamot, Bergamot.
Okay.
So bergamot will do it, N-acetylcysteine, NAC, and hyperfolate, which is folic acid, 5,000 mics. Those three things are benign, absolutely benign, will bring down the cholesterol. But you have to get the thyroid under control. If you don't get the thyroid under control, it doesn't make a lick's bit of difference what's going on. More so is thyroid medication is cheap if it's done right. If you're taking Tyrosint, it's expensive. You take Synthroid, it's less expensive. Nature Throid, it's cheap. Armor Thyroid's a bit more expensive, but you're really not talking more than about $30 a month.
That's not bad at all.
No, but if you're the Bergamot's about 40. Okay, so that's one of the most expensive medications that we use to treat cholesterol. So people say, I want to do it naturally. I try to convince them not to because it's actually less expensive to use some of these other sorts of things. But the statins cause problems. Okay, they'll cause your body to it decreases the amount of pregnenolone, cortisol, testosterone, estradiol, androstenedione, and 150 adrenal hormones take a dump with regards to amount. So people tend to get sick. They tend to feel lousy. They tend to feel demented. They can't remember this. They can't remember that, all from the use of statins. Then come the folks that really, have it all figured out. CoQ10 deficiency results directly from the statin. And so then why didn't you start your patient on CoQ10 immediately when you started the statin? The question I've often asked, if you knew that it's a problem, why didn't you prevent it? So it causes muscle damage and nerve problems. I'm not a big statin fan, but N-acetylcysteine will lower it. Folic acid will lower it. Bergamot oil will lower it. Those three things will do it. You can use olive leaf extract to lower it. I've got about 15 different ways to lower cholesterol, but probably the one that's going to be necessary is going to be thyroid hormone.
There you go. All right, let's go ahead and take a call from Wayne, if you don't mind. Hi, Wayne. Wayne is from Orlando. He says vertigo is the issue. He is 72 years young. Hi, Wayne. Welcome to Stages of Life Radio.
Yes.
Okay, Wayne, what's going on?
I've been dealing with vertigo. I've had it off and on for years. I had a severe episode and ended up actually in the hospital for a couple of days.
All right.
And they did a bunch of tests and stuff. They did a VNG and a CDP.
Yeah.
And basically, they didn't find anything with their other X-rays,
Well,
CAT scans, and a PET scan, and they got me doing physical therapy.
Good. What they did is they made sure you didn't have a tumor causing this. They did all the right stuff. Okay. Make sure that you don't have a cholesteatoma. Make sure you don't have an eighth cranial nerve neuroma. Nothing going on in the cerebellum. All appropriate pieces of a workup. But then you're still stuck with vestibulitis, which is almost always one of two things. It's either going to be viral, and you assume it's viral because you can't find anything else wrong. So the typical answer is, well, what causes it? Well, it must be viral. What virus? And you get a blank stare because guess what? Nobody's ever really figured that out, which means it's probably not correct. But autoimmune diseases can cause vestibulitis. That is what happened to me. Okay, I was disabled. Okay, I was just a practicing physician, and I was disabled for 2.5 years with Meniere's disease. That's vertigo, very severe vertigo. If I stood up out of my chair, I would vomit. The hearing loss, the tinnitus, all that stuff that goes with it. And that was what happened to me before we made the diagnosis of Hashimoto's thyroiditis. So once I got the Hashimoto's under control, the hearing loss never came back. I got to tell you, the tinnitus has gotten somewhat better, but the vertigo hasn't bothered me in years. But I'm still scared to death to go up ladders because I have fallen off of them. You climb up a ladder once or twice and the world starts to spin and you end up on your back on the floor. You learn something called an aversive stimulus. It's a Skinnerian piece of psychology, a paired stimulus. You end up, getting a shock from touching something. You don't touch that thing ever again. So we'll talk about how we fix this when we come back from these important announcements.
Yes. We'll also address the question about Metformin. It is safe. That's the quick
safe
answer. If you have a question, 407-422-1212, or you can text us 23680. You're listening to Stages of Life Radio every Sunday afternoon from 4 until 5, right here on News Radio WFLA. Yay! Okay, this is a very short segment, then short commercial break, which I'm fine with. So, yeah. All right, let's see. The Bears won. Okay. And New England won, and we got another phone call.
Well, how'd the Skins do? We can't call them the Skins
Which
anymore.
Skins?
Yeah, which Skins?
Oh, the Washington football team?
Yeah, the Washington football team. Yeah, we're not going to name them anything.
The football team, I thought they were. I think they were losing last I had seen. I don't know.
That's usually a good bet anyway. I've been a Skins fan since I was a little kid.
I'm so sorry for you.
No, you just learn how to deal with disappointment. You know.
I see. Okay. All right. We did have a question on here. It was back with Deb's question about being allergic to seafood and taking fish oil. I told her if she was really, she's avoided fish oil of seafood forever.
Yeah. If it were me, I would test it.
That was a mistake. No, that's not pause. Stop. There was not pause. Okay, there was no pause. Oh, concerning CoQ10, is there any brand that is best, or are they all the same?
No, they're not all the same, and there isn't any one that's best. You can spend a lot, or you don't have to spend very much. What you do is you look at the bottle, and then turn it around for other ingredients. And if anything in there says soy or lecithin, you get rid of it. It's not any good. So the cheaper ones, regardless of the price doesn't mean good. If it's made from lecithin, which is soy protein, it is poison. It's bad news. So it's got to be soy-free, lecithin-free. Wickedly important. And then it doesn't matter. Then you shop price on it. We have a pretty decent one. I've seen some that were every bit as good and $1 cheaper. But you do not need to spend a lot of money on CoQ10 to make it right. But you do need to know the dosage.
10 seconds.
100 milligrams is the usual dosage to prevent problems. If you start getting into things like atrial fibrillation, the dosage goes up to 300.
Well, look at that. We're back at Stages of Life Radio with Dr. David Klein from Stages of Life Medical Institute right here in Longwood, Florida. You can check out stagesoflifemedicalinstitute.com or any of the products that Dr. Dave has recommended. Go to stagesoflifevitamins.com. It's pretty simple there, right, Dr. David?
Yeah, you can go there, and if you just click on the darn thing and then cursor down the page, you'll see things called audio files, and you will hear me ramble on 10 to 15 minutes at a clip on a particular item. And not to say, well, you got to buy this item. No, but disease states that are treated by that. These are not sales pitches. They're actually 10 to 15 minute radio clips. Yeah. From either a couple of years ago, last week, or whenever. So that's pretty much the way I do that. So if you need to learn about, let's say, osteoporosis, so you go to strontium, cursor down the page, listen to one of the 10, 15-minute lectures that I've done on this, and you'll learn something about osteoporosis. Thyroid disease, you could learn about hypertension, depression, constipation, whatever. So all kinds of stuff. I've been on the radio a long time, so there's an awful lot of material for me to draw from.
Yep.
So it's all there for free. You're welcome to look at it.
Very simple.
Listen to it, actually.
Stagesofliferadio.com, stagesoflifevitamins.com, and now Bob from Apopka. Bob, how are you? High blood pressure, low pulse rate, 72 years young. Turn that radio down and let's talk.
What you got, Bob? He's there somewhere. Earth to Bob.
Hi, Bob.
Yes.
There you go. Okay. So, Bob, you're on the air. What's your question?
I just recently, in the last couple of weeks, noticed I'm starting to get high blood pressure, but I have a low pulse rate. It's always in the 40s.
All right.
And the blood pressure is between 150 and 170 over 85.
All right.
Is there anything that you have any concoction in your shop that I might be able to?
Okay,
try?
Bob. Let's start with let's figure out why. Okay, so if you have a low pulse like that and you haven't had it before, we need to figure out why that's changed. Because if you end up with, let's say, a conduction defect of the heart, and now you're seeing ventricular rate of 40, the last thing that I would want to do would be in any way scramble things up until I figure out whether or not you need a pacemaker put in there. So if your pulse is too low, okay, to actually kick out enough pressure to the heart, you will see a reflex increase in blood pressure. That will happen. That is not that's not necessarily something you want to ignore. So you need to make an appointment like tomorrow to figure out why. Do you have a family doctor?
Right.
Do you have a family doc?
Yeah, I do. I have a cardiologist.
Oh, even better.
Conferring with him.
That's where I would go with it. I would call your cardiologist up and try to convince that person, okay, that they're not going to do this by telemedicine, to not be a sissy about all this nonsense, and to actually meet you in the office, all right, and have them listen to your heart, do an EKG, probably a cardiac ultrasound, to find out what's going on with you. Because if something has changed to knock your pulse rate down like this, you need it to be dealt with. So I get this particular issue in my office maybe 3 to 5 times a year. And more times than not, it turns out to be atrial fibrillation. Okay? When that happens, go on.
Mm-hmm.
Okay? So you need to call the cardiologist tomorrow. Okay, Bob, you promise me you'll do that?
Oh, yes, I will.
That's the right answer to that question, is get somebody right on this one. That's an emergency right there, my friend.
Yeah, that does not sound good at all.
No, you got to do that now, and this is not a telemedicine game here.
We have a text that came in very early, and I hope they're still listening. Of course, I hang on every word, so I'm expecting that our listeners will do the same. Again, you can text us your questions at 23680. This one says, I fall asleep easily in the evening, but then I wake up early, around 4 a.m. So aside from suggestions of listening to George Norrie and the overnight show here on News Radio WFLA, can you give them some suggestions?
Yeah, there are a couple things. When you see what's called mid-insomnia, and you wake up 3 o'clock in the morning to 4 o'clock in the morning, it's almost always a low cortisol that's causing this. Cortisol is supposed to go up around that time. If it doesn't go up enough, you can't stay asleep. So what I would be doing would be a couple things. One, I would like to know what your cortisol level is doing, just to confirm the diagnosis. The second thing is stop taking naps in the evening. Make sure you're not taking naps. The second thing is don't eat too late in the evening, and certainly don't drink alcohol after about 8:30, 9 o'clock at night. So if you eliminate all that and you're still waking up at 3 in the morning, 4 o'clock in the morning, let's get some blood work and see what your cortisol's doing. So what I have people do when all of that is okay, and that's what I'm hoping the case is here, then I use a combination of melatonin, something called Gaba, which stands for Gaba aminobutyric acid. It's the most marvelous of all sleepers. The dosage is 750 to 1,500 milligrams at bedtime, and L-theanine. That generally does the trick. To that 10% that doesn't respond to that, I'll add CBD oil. That seems to do the job, but you got to make darn sure that you're not looking at hypoadrenalism or something called adrenal fatigue. But again, you'll see many withdrawals from alcohol. So if you're drinking wine at night, you got to stop it. Your body's not allowing it. If you have reflux esophagitis, that too will wake you up. So all of those things aside, the way I would handle it would be GABA, L-theanine, and melatonin.
Ooh, okay. All right, there you go. Simple answer.
Yeah, maybe simple.
Well, no, pretty simple. Here's another one. What's the difference between the rapid test and the nasal swab, referring, of course, to the COVID-19?
Rapid test is called an antigen study, and it's got lots and lots of false positives attached to it. It's not a particularly accurate test. In fact, we do these in my practice. We do the nasal for the PCR. We have 2 different PCRs. We also do the antigen. We do 2 different types of antibody testing. One is quantitative and the other one's qualitative. If it were me and I were really concerned that I might have COVID, I would be doing the nasal swab, which is called a PCR, which stands for polymerase chain reaction. So the PCR, we do them for $102. It's pretty reasonable. Our turnaround time is typically 2 to 3 days, sometimes 4 days, but 2 to 3 is more like it. When people have to travel, we can do it within 24 hours. Of course, that costs a couple bucks extra.
Right. Where do they go for information on that?
That one. Okay, so if you call our COVID hotline, it's 407-636-3945, and we can set you up with that. And that's easy. It's 407-636-3945. Piece of cake. But I'm not a big rapid test guy. I think you pay the same, actually, for the rapid test as you do for our PCR. You get good on one, crappy on the other.
Oh, so. Okay, very good. And finally, is Metformin still safe?
Yeah, it's still on the market. If it weren't safe, they would have pulled it off years ago. Metformin has a couple issues. One, it can cause nausea, and it can cause upset stomach and diarrhea. That generally happens when it lowers your blood sugar too quickly, your insulin too quickly, and it generally precedes weight loss because metformin causes weight loss. Predictably. Very, very interesting, and you can get it for free, wouldn't you know, at Publix.
Well, how come I'm not on Metformin?
Well, you didn't ask for it.
Can I have it, please?
Of course you can.
Okay.
There you go. It's that easy.
Wow, that was pretty small. That really was. Well, no,
Metformin,
I mean,
it works. It works. It's just a marvelous medication. It's been around since I think 1912. It is awesome. But again, Publix gives it away for free. Now right now there's a problem with Metformin ER, the sustained release, which they used to give away for free. Now there's a shortage of it.
That's the issue.
There's a shortage of it right now, and there's some pharmacies that are charging upwards of $1,000 for something that we were getting. I think we were buying bottles of 1,000 for $40.
Oh my goodness. All right, so it's been a great time as usual. Thank you all for your calls, texts, and more. You've been listening to Stages of Life Radio. Dr. Dave, say goodbye.
Adios.
You've been listening to Stages of Life Radio with Dr. David Klein. Check out stagesoflifemedicalinstitute.com or stop by 1917 Booth Circle in Longwood near the intersection of I-4 and 434. Call 407-679-3337. That's 407